Hello, everybody, and thank you for joining us on our educational web series. My name is Michael. I'm a speech-language pathologist, and I'm with Providence Home Health and Hospice. We are a local company based right here in Wichita, and I love being part of something local because I feel like we really have a grasp on our community and the needs of our patients and those that we look to serve in the future. Today, what we're going to talk a little bit about is physical therapy. One of the things that I've found in my time as a clinician is that oftentimes what therapy does can be confusing, so we'd like to just take some time to clarify some of that. Physical therapy these therapists are amazing clinicians. They really help keep people off the ground and on their feet. Mobility is the goal here. They place a special emphasis on aging adults, and just a few of the conditions physical therapists work with are arthritis, osteoporosis, cancer, joint replacement, including hips and knees, and balance disorders. The goal is to improve or maintain mobility, increase fitness levels, and to reduce overall pain. Speaking of pain, all of our clinicians are trained at every visit to ask if our patients are having any pain. Pain can affect us physically, but it can also affect us mentally and cognitively. I was recently with a patient, and when I asked if he had any pain, he said, "Of course I do, Michael, I'm old." And I said, "Wait a minute now, that's not a normal part of aging. Just because we're getting older does not mean we have to have pain, and if we do, it doesn't necessarily mean we have to live with it." Pain is not a normal part of aging. We all have arthritis. It's just to varying degrees and severities. Our physical therapists are highly trained in pain management and have eliminated or decreased the pain in all of the patients we've had the pleasure of serving. The goals of our physical therapists are as follows. We want to help individuals reduce the risk of a fall, lower the risk of injury, decrease pain from chronic conditions, lessen the need for prescription drugs, and help aging individuals maintain an independent lifestyle. There are some signs I would like all of you to be aware of and to look for in yourself, your friends, and your loved ones. And if you see any of these, please be proactive. We really strive to be proactive here rather than reactive. I'd much rather work with an individual before an accident happens than when they get out of the hospital due to a fall. So, some of these indicators are difficulty transferring. Does it take several times to try to get up from a chair? And when you or your family member sits down, do they just plop down? Or do they reach back and grab the chair and sit down properly? Is it difficult to get in and out of the shower? And is there additional help needed to get in and out of vehicles? Oftentimes, this can be very challenging for individuals with mobility deficits. And then difficulty with ambulation or walking. When walking, does the person have to hold furniture or hold the walls so that they don't fall over? Has the physician already recommended a cane or a walker? We see this all the time, where a cane or a walker will be recommended. However, there's no training that goes along with it. These are durable medical equipment devices, and training should go along with anything that you receive to help you with your medical conditions. Does the person shuffle his or her feet or show poor balance? And does the person need to take breaks often? If maybe getting down the hall was once done with ease and now they need to take a break halfway down, there's a good chance that their endurance and stamina could be improved. So, if you or a loved one are experiencing anything like this, we will send a certified, licensed physical therapist to your home at your convenience to develop a plan that's tailored specifically to you and your needs. If you, a loved one, or a friend are experiencing difficulty with any of the issues that we spoke about earlier, please don't hesitate to reach out immediately on our Facebook or give us a call at 316-558-5956. And we'll work with you to set up a time that's convenient so that we can go over everything with you and make sure that you're a part of your recovery or your therapy. Thank you so much for your time today. I do want to add in that home health services are generally paid for at 100%, meaning there's no out-of-pocket cost. That's one of the many benefits of home health that oftentimes people are not aware of, and I always want to pop that in there. So thank you for your time today. If you or a loved one needs physical therapy, we would love to be the company that serves you. Thank you so much. Have a great day.